This module's purpose is to introduce you to the FIU College of Medicine's newest assessment form, the Clinical Assessment of Student Performance, or the CASP. The CASP helps you assess the clinical skills and professionalism attributes a student demonstrates during their time with you. But first, why should we care about getting reliable and real information about what students show that they can do in the clinical setting? Basically, because that information is really important to everyone who cares about the quality of medical education. It's certainly important to the learner to help her or him in developing their various skills as physicians in training. Reliable information is important to the clerkship directors and the curriculum developers here at FIU, so we know how good a job we're doing of preparing students to learn with you. It's important to helping us identify those very few students who really need special attention from clerkship directors and clinical faculty in order to move on to residency, and ultimately safely take care of patients. Our quest for accurate information has led to our Reaching Real ratings, helping our students do their best campaign. What is the CASP? That's what we call our Clinical Assessment of Student Performance. The CASP has 4 sections. Like the forms you've seen before, it asks for your comments about the student's strengths and areas for improvement. It's got questions on clinical skills like taking histories, and finally professionalism attributes like respect and punctuality. This is the first section, the narrative comments section. We ask that you comment on what the student does well and on what the student can improve. Just 1 or 2 details here can go a long way to helping clerkship directors and students understand what you feel is important. Remember the option of using your smartphone to dictate comments. All you have to do is click on the dictation button and dictate your comments directly into the CASP. Read over the comments because dictation is not perfect. But don't worry about spelling or anything else. We'll figure it out. After the narrative comments comes the second part of the CASP with questions on 9 aspects of the student's clinical skills: interprofessional and communication skills, history taking and interviewing, physical examination technical skill, forming an assessment, making an evidence-based management plan, critical thinking, clinical problem solving, oral presentation, clinical documentation, and ability to work with others collaboratively. For each of these 9 questions, please always remember that you have the option of checking unable to determine, and rest assured that picking this option will not lower the student's grade. We want you to feel free to do this if you don't observe the student doing that skill. Instead, the score will be adjusted by increasing the value of the other items that you did observe and rate. If you are able to assess the student for a question, then there are only 3 options to choose between. To help you quickly read these options, we bolded the important words that distinguish between the options. How does this form determine the student's score? For items about clinical skills, specific number of points are assigned for each rating. This total is then turned into a score that is part of the clerkship grade. We've designed the answer options so that the majority of our students who are doing very, very well will be marked at this middle option. When you rate a student at this middle level, the points they get will result in a strong overall clerkship grade, more than enough to support them in matching into good residencies and moving on with their careers. If you rate a student as low or high performing on any questions, it's very, very important that you give a detail or 2 to explain that rating in the narrative comment box. When you forget to provide these comments, the clerkship coordinator will be in touch to ask you for a few comments to help support your ratings of the student. We really need you to help us identify those few students who need extra help as early in the clerkships as possible. Several of the questions refer to simple and complex. What is simple and what is complex? We want you to use your own definition here. If you mostly see complex cases, then consider what is simpler for you to care for as a clinician and do your best to extend what you learn about a student's abilities with complex cases to how they would deal with a simple case. The third section of the assessment form consists of the items assessing student professional attributes. These are softer things like emotional intelligence, commitment to self-improvement, discernment, conscientiousness, accountability, truthfulness, respect, attention to patient comfort, adherence with roles, procedures, and syllabus, and punctuality, attire, and attendance. These items are not factored into the score that this form contributes to the grade. Rather, the clerkship director looks at your ratings for these items, and if your marks here suggest that you have concerns about the student, the clerkship director will likely contact you for more detail or clarification. If the clerkship director judges after looking at all of the assessments a student receives on a specific rotation that the student has demonstrated concerns around professionalism, the clerkship director will consider deducting a small number of points from the clerkship grade. More importantly, the clerkship director will be talking with the student to find out if there are any underlying issues that need to be sorted out. So the bottom line is that your ratings here do not translate directly into points for the grade. Rather, these ratings are holistically considered by the clerkship director to adjust the student's grade for those few students who are exhibiting evidence of unprofessional behavior. The last item on our assessment form asks you how much you needed to help the student in obtaining the history and performing the physical exam. This is something we've never asked you for before, and it will not be factored into the student's grade. It's a new approach to getting reliable ratings, and this year we are simply curious to see how our faculty use it. We understand that necessary supervision can vary with factors beyond the student's control, such as how complex patients are and patient comfort with seeing students. Let's talk a little bit more about narrative comments. Your comments are crucial and allow the clerkship director to provide feedback to the student to help the student improve as a clinician in training. As we've already discussed, assessments are based on your direct observation. Comments which include specific details about what you observed and how you judge those observations are quite meaningful. As we've already noted, your comments provide feedback to the student and also help us know why you rate the student as very high performing or very low performing. That is, your comments are necessary to justify those outliers. Why did you feel this student's performance was outstanding? Why did you feel that student's performance was not adequate? Comments also allow you to check your biases. For example, if you've just worked with a challenging learner, you may be so relieved to work with the next learner who is not as challenging that you award high marks. Then, when you are writing the comments, you realize the learner's performance is just average, and you can appropriately adjust your marks. This is a way that your comments can help you to check your biases. We offer free CME for completing an online teaching module entitled Module 1, Narrative Evaluations of Student Performance, which can be found at this website. This module takes you in depth into writing narrative comments. To complete the CASP, you likely will receive an email that looks like this. One way to be efficient in completing the CASP and including comments is to click on this link on your smartphone. And again, then just click on your dictation button and dictate your comments directly into the CASP. Read over the comments because dictation is not perfect. Let's look at a couple of examples of narrative comments and consider how we can improve these comments. How can these comments be improved so that they are more meaningful? Just by adding a few details, these comments become meaningful to the student and the school. Now there is an example of 2 cases in which the student was able to quickly obtain a history and physical exam, and the student has clear details about how to expand the differential. These comments describe a strong student but are not really specific. How can these comments be improved to make them more meaningful? By adding that the student's oral presentations improved with feedback and that she taught lithium side effects to the team, we have specific examples of ways in which she contributed to patient care and to the team. Even strong students need to know how to improve. Previously, the example did not include comments about how the student could improve. Adding that the student can consider next steps in treatment gives this learner a concrete way in which she can grow. We'd love your feedback. If you would like to let us know how this form can be further improved, or if you have questions or concerns about working with or assessing students, you can contact your clerkship director, Dr. Len Gralnick, your associate clerkship director, Dr. Eugenio Roth, your clerkship coordinator, Ms. Emily Gonzalez, or your director for clinical faculty development, Dr. Suzanne Miner.